Hey, buddy. All right, you cat, skedaddle, skedaddle. What's going on in here? Oh, kittens! Let's see if some kittens want some breakfast. And should we do some tea waters for you? That would be nice. How about some kibbles? Hi, kittens. Good morning. I will give hugs in a minute. Well, hi, Miss TJ. Oh, Miss TJ. Oh, stop. Look at the bunny. Watch out, Miss Bunny. I know, you're not invited, Miss Bunny. There's some water. Oops. No. No, kittens. No, no. No, this is where kittens go for now. No. No, no, no. I know. Maybe we'll go downstairs. We'll see. We'll see. Okay, watch your toes. Everybody watch your toes. No. Oh, oh no. Oh. Oh, Mr. Slow, you're slow. Horrible. cute. She's so cute. Okay. Here you go. One for you and for Morby. All right, let's do some. Don't you want your breakfast? Go eat your breakfast. Look, so tasty. This guy is big butt, if you don't I know. Watch out, little Smokey. Guess we'll do it up here. Oh, there's a bunny out there. That bunny really wants to come in. Oh, he's fine there, Martha. Cramps, everybody. Trying to figure out how to get in there. Mama Chef, you can go in. Move along, buddy. Not for you. Ooh. Oh, everybody's escaping. Are you high on the end? Marby. Oh, Marby. Breakfast. No, you were not invited to this party, buddy. Oh, no, you don't. Oh, Pranceroo. You're not nearly as brave as these kids. Actually, leave that there. Mr. Hilo. Put your toys away. Oh. You aren't allowed. You aren't invited, buddy. I'm very sorry. I'm very sorry, buddy. Oh. Watch out. Alright, vacuum time. Maybe I should just oh, that's nice. No, obviously not. Obviously not, buddy. No, you're so fat. You're so fat. We still love you, but you're very fat. Where's everybody going? They're all out. Watch out, buddy. All right. That's better. Hi, Miss Starbuck. Ooh. Oh, a little pee. Oh, bunny. No bunnies invited. Nope. I know. You too. He's up there trying to figure out how to get food. Look at Little Pete, the only good one. There's a toy box. Where did their bed go? Somewhere. Where did all the kittens go? Kittens? You're not a kitten. You're a kitten. Oh. You're the only good kitten. Alright. Oops. Alright. Team's out. That means you. Hello. Hello. Hey. Oh. Okay. New address is 917. Come on, Marty. Marty. Marty, come on. That Barbie, she's so fast. Okay. Let's see. I'll probably sit over here. Let me get my cover down here. So Dr. Ferguson is en route. Can you guys all hear okay? Kittens. Oh, Smokey. Oh. Okay. Uh-oh, what happened? Oh, nothing. Oh. Out here? Ooh, should we put up the extra special tent? This is the best way ever. Your nice little is.
Okay, everybody. Everybody let me know if you can hear okay. Kittens.
All the kittens are doing well?
Yes, all the kittens are doing well. Everyone remembers Dr. Ferguson, I'm sure.
No.
I should adjust.
Awesome. And do they all have homes?
All the kittens do.
Do?
Chef and TK do not. But hoping something happens. I'm going to keep them until the little girls get their space, and I hope that someone falls in love with them.
When are they getting their space?
They're like 30 grams, so
Week and a half.
yeah. That's what I'm thinking. But they're still teeny tiny. Teeny tiny. Here, Mom.
Come here, you monkey. Let me feel your tummy. This little guy's a turkey because he ate part of his collar last week. We're keeping an eye on them. Okay. Good boy, Hilo. You're very cute. Hilo's still doing well?
Sorry. Try to find you a mom cat. Try to find you a mom cat. Oh, here they are. Hi. Hi, girls. Hi. How are you?
It's really hard to see on camera what her face looks like.
Yeah.
I was trying to peek and it was really difficult.
Do you need better light?
Maybe, maybe not.
Oh, goodness. Okay. Plan B. Plan B.
Is Plan B chef?
No. I'm gonna. Well, yeah, I can do chef. We can do chef. Where's chef? What are you doing?
Just so they do that.
I know. Are you like a lapsed volunteer or?
Yeah.
Oh, are you? Oh, nice.
Oh yeah, I'm with the dog
Just-
side though.
Oh yeah, just doing this for sort of fun, or
Well-
this is your profession also?
No, I'm retired sales.
Oh,
So this is, I was just talking with Jane and talking about the upcoming event. And just somehow the conversation moved over to the fact that my son has a semi-professional camera. Ooh, you feel bads and everything.
oh wow.
Kind of film cats.
Film cats. Good girl. Good girl. Excuse me, putting my back to your hair. Sweet old sweet. Huh? It's okay, Mama. Yeah, you like it. Good girl. She looks slightly better in general.
Yeah, the swelling seems to have gone away, except she had a little bit on her cheek right here.
I'm gonna come a little closer to you, okay? You push that over a minute. Should we just give her a minute, or take advantage of this
I
for
think-
being quiet?
Yeah, just go. I think she'll mind. Good girl. That's a good girl.
So TK had some biopsies done of her face because it wasn't just a typical infection, and it came back that she has feline eosinophilic granuloma complex.
Good girl.
And so we have a couple of options for a plan that we can talk about. So we're halfway done. She may have even helped us.
Good girl.
Maybe they put it in. Oh, one more.
Good girl.
She didn't. She didn't do her own suture removal. She's a very good girl.
She gets wild and crazy sometimes.
See you? I understand.
Yeah.
Girls got a pardon. Oh, her lip looks quite good.
Yeah.
Has she had any more of that swelling?
No, so it came in over the bridge of her nose. She had quite a, it went all the way across, and then now there's a tiny bit. Yesterday there was a tiny bit on that side of her cheek, like right around. But it actually looks for here, I think. Maybe.
Is she
Yeah.
doing any sneezing at all? Or eye distraction?
No. The others have some eye discharge, but she has not really had any since she's been here. Good girl. Good girl.
You're very beautiful. And look in here. We also cleaned her. Say ah.
I know, it's so nice that she gets to go home with a clean
Teeth.
mouth.
And her skin really looks quite good. I'm pretty optimistic. So there's some options. My favorite thing for her would be to maybe once the kittens go, is for her to be on a hypoallergenic diet and see how it goes.
That's the most likely cause of the allergies?
It would be the first one. It's a possibility. They think also that feline eosinophilic granulomatous complex, it can be multimodal, a couple different factors.
Oh.
Sometimes, and there is a little bit of controversy, sometimes it can be linked to feline herpes virus. Have you read about that? So I don't know if, even though this is just a wonderful atmosphere for cats to be homeless in and fostered in, like, you know, they're all having a good time and they're eating and drinking, it still is probably more stressful than in a permanent home.
For sure.
And so maybe when she's if she gets a hypoallergenic diet and she's in a more, you know, less stressful environment and hasn't come from the streets to a foster home, maybe it just evens out. Because there's options as far as possibly steroids and even maybe antiviral treatment for herpes. There's medication that you can do. That's why I was asking about her eye discharge, because if we think she has herpes virus, I don't know if we want to take a plunge, especially when she doesn't look very severe, and put her on steroids. Right. I'd rather just watch her really closely, try diet, maybe even some lysine, and see how it goes. And then, you know, maybe this is as bad as it gets, and it only gets better. Yeah. You know, it's really a spectrum, and pretty manageable.
That's what I was hoping, that maybe it was something like just the stress of coming here and then she was at Laps for a while in there. Yeah. Kind of a noisy area, and
lots of changes in
then the spay and all of that, and I was hoping that maybe,
because it really looks quite good. Like
it's gotten much better than it was.
It does look quite good. So maybe if we peek at her each week, or we share pictures, or we can see, then we can decide if we need to step in with medication on top of it or not.
Okay, well, that's good.
And as a goal of maybe trying to figure out if we can get her on a hypoallergenic diet, just in case.
So if someone is out there trying to or considering adopting, do you think so they just have to be vigilant to keep an eye on it, and if something flares up, maybe bring her in or call their vet?
Yes, and I think it's possible that she may require a good quality hypoallergenic diet, which really these days, versus a regular good quality diet and a hypoallergenic diet, the cost is not that different. And cats, it's not like they're a Great Dane, they don't eat huge volumes, so it's not that bad. And keeping an eye, and hopefully with, like I said, less changes in her life. Yeah. Hopefully it just sort of calms down. It's nice though that Labs went ahead and they did the biopsy. You know, because then at least they're going home, or potentially home with a possible, like with a diagnosis. Yeah. And it's not up in the air, and people don't have to start from square one. Most of the work has already been done. We just have to see if she needs any medication at all, even maybe not.
That's good. So it's maybe the prognosis is better than we were originally.
Yeah, I'm really thrilled with how she looks.
That's awesome. So, and should we look at Chef too? And we'll see. So you guys can hear okay, right? I think it sounds like everybody can hear. I'm gonna turn it up a bit.
How are you, Bunny? Bunny wants some love.
I know. Bunny loves you, Kittens. She hasn't gotten her morning mother. Hi, Mama Chef. What are you doing? You can do it.
I was surprised online how many people that watch your Facebook page don't realize that Labs automatically, which is really awesome, gives them treatment for external and internal parasites.
Yeah.
Like, I have never, with a lapsed animal, unless it is the day that it's come off the street, never seen live ear mites.
I haven't either.
No, I've seen dead ones because they've been treated, and then I've seen them because they treat them as soon as they come, and then they start with a deworming program, and a deworming program that's academically ideal. They don't, it's not like the cheapest, but it's ideal. So I know that some people saw the tattoo. What did they see the tattoo on?
Probably Gaius.
Yeah, it was on Gaius because it stood out because he was orange. And you know, Labs does an amazing job of taking care of these guys and deworming them.
They do try to focus on medical care, and we never want to send a cat home with like masking the symptoms of something so that it shows up once they've been adopted, because we want the adoptions to be successful. So
let me see you, gorgeous.
That's why we're doing all this work.
Oh, hello, good girl. That looks better too, eh?
Much better. And she's had nothing else that It's okay. It's okay, Mama.
You want to just come a little closer? So we also biopsied Chef's face because she came up with a lesion too. She did not come up with exactly the same problem that TK came up with. She's going to be a little more difficult because she has dark hair. I don't know who the vet who put the dark blue suture in the black hat. Maybe on your, against you. She came up with possibly an allergic dermatitis. Still could be related to feline herpes virus, which is at some point in life probably every cat gets exposed to. And feline herpes virus can cause lesions. They did not see any viral evidence in these lesions, but it doesn't mean that it's not the cause. With her,
that's interesting.
Yeah, it doesn't mean that it's not. They just didn't see them in there. With her, I'm really encouraged that.
Good girl.
Very lovely. That she looks way better also. There's one more.
So a lot of people were asking, because I talked about how it could be food or environmental or even seasonal. The carpet that was in there, that came up several times. People were asking about, could it have been the carpet?
I don't think they'd be allergic to the carpet, but is it possible that the carpet holds some allergens, like environmentally? The one thing we struggle with a lot in this part of the world and on the Lower Mainland is allergies, because it's 10 degrees and raining a lot here. Yeah. So we never often, this summer was a bit of an exception, but there's a lot of opportunity for allergies because we have very sort of mild climate. So people will often move to this area and their pets have never had allergies before, and they move to the Lower Mainland and they have allergies.
Well, that's encouraging. So
I think with her, ideally too, it would be great for her to just keep an eye on her, watch for any other lesions. It's certainly not going to hurt, and it very well might help for her to try a hypoallergenic diet also, and just watch.
Okay. And it's possible that for both of them, it may never come back?
It's possible.
Okay. Yeah. And worst case scenario is it just comes and goes.
It comes and goes,
and they just stay on a special diet and or treat with prednisone.
Very worst case scenario is that they need a hypoallergenic diet and they need medication to keep it under control. As far as the spectrum of severity of these types of things that I've seen, these guys are not high on the severity spectrum.
So that's good. Not high, not high on the severity spectrum is good.
No, but you know what, it's still nice that they have a diagnosis. Even though it wasn't too severe, nice. you got
because it was so, I had never seen anything like that before with the swelling just migrating all around. It was very strange to me.
Yeah, but it's not that uncommon. I had another kitty the same week that I had these guys come in with it on their cheek too. So it's common enough that vets see it, that routinely.
Good girl.
She is lovely. I'd like to just look in her mouth too if she'll come back. She says nothing.
She'll come back when I go get her. And so feline herpes virus, is that something that people should be afraid of when adopting a cat or kitten?
No, no, I don't think you should be afraid of it. I think you should be aware of it.
Yeah.
Pretty much every cat, unless it's been totally isolated, at some points in its life gets exposed to feline herpes virus. It's the cat's version of a cold sore. The people can't get it, but cats get exposed. Like some people get plagued with cold sores. Some cats get plagued, and sometimes they get exposed to it once and they never get it again. And sometimes when they're stressed, they'll get a little bit of runny eyes or a little bit of sneezing. I had a cat that anytime I used to go away and have a house sitter, her eyes would get a teeny bit runny.
Oh. Mm-hmm.
And it never turned out to be anything more than that over like 20 years. But and she was a kitten that was found on the street too, actually on a golf course.
Oh.
Yeah. No, her mouth looks wonderful.
She's got a little, this side that is runny.
Here on her eye.
Yeah. But I've been giving her lysine.
Oh, cool. That's wonderful.
And the babies.
I love lysine because it's really do no harm and it very well might help. Girl. And they were lovely, and they were really lovely when they were in the hospital. Not overly stressed, interactive.
They're very sweet cats, and they've had a lot of disruption, and I think it's amazing they escaped once, and they encountered my cats, and there was no hissing.
Yeah.
And now they've been out with them a few times, but Bunny even hissed a few times, but these guys didn't hiss or growl or swat. There was nothing from TK or Chef. They're just so they're so laid back.
You know what I was thinking, and our staff said it, and I'm gonna just check your memory cards too. Is the animals from Laps is they come in and they're all sweet. They're all easy to work with, and I think it's because of all the foster and all the TLC that they get. They're socialized, and then they go to homes and they come in and they're still happy. They're not coming in and they haven't spent their period of time pending adoption just in this little steel kennel. They've been at homes, they've been loved, they have wonderful volunteers. Like it really makes a difference.
That's one of the whole reasons Laps was started, was because Patty Dale, who has since passed away, she saw the cage situation and was like, no, we need to also take care of the psychological and emotional welfare of the cats as well, and dogs as well as the medical stuff, and getting them off the street. So I think they've done an awesome job. It's
really mind-blowing when you see the difference, and you're used to seeing animals come from different situations all the time. When you see these guys come and they're so happy and adjusted, and they can come and they'll spend part of a day with us and not be stressed. And then they come in with their new families, and then you hear from their new families that they're very relaxed also. It's very awesome.
That's awesome. I know.
I love it. It's very awesome.
I love that you get updates, so you get to see them after they go.
Some of them I know.
Yeah, that's fun.
It's very sweet.
Yes. Kittens, where are all the kittens? We found something exciting to play with somewhere else.
So, is that Smokey?
Yep. Mr. Smokes. He's going, Smokey, Starbuck are going together.
Oh, nice.
Kilo and Guys are going together. Lil P and Marby are going together. Anders is going on his own. And I'm hoping someone will adopt Chef and TK together. So, but I haven't heard back from anyone. They're getting very coordinated with their pounces. Fierce hunters. Let's see, does anybody have any questions for Dr. Ferguson while she's here? I'm trying to scroll back and see. Oh, they're saying, and Laps is very fortunate to have Dr. F.
Oh,
That's very true.
I'm just glad that I get to do a small part.
Small part. Yep. You have no idea actually what it's like. Well, before you came around, things were very different. I've learned a ton from you, and no one else has invited me over to do fluids and
over to their kitchen counter.
So that's pretty awesome.
You know what's very awesome? Like my kids though, they will play animal shelter. Like I'll come home and they will have little stuffed animals lined up, and they'll have
so cute.
And I'm just like, yay! You know, like of anything. Like, and the Dawn's daughter who brought over
Oh,
flowers, it like
she's
teaches
so
kids
cute.
compassion and
Mhm.
stuff. Like it's just so awesome.
Totally. Do they have like little toy IV bags and like?
No, just leashes and beds, and then there's little bowls set up for
Oh,
food and
that's
water.
adorable. Oh my gosh, that's cute.
My son wants it. When I grow up, I want to do what Jane does.
Oh.
And he met her once.
That's
It was
so
very sweet.
cute.
Yeah.
Aw.
I know.
Adorable. Oh, let's see. I asked you a question, but then I got distracted, like I always do. Let's see.
Okay. Okay, I'm gonna head over to the last.
Okay. All right. Thank you
Thank
for
you.
coming.
Nice to meet you.
Nice to meet you.
Yeah.
I'm looking forward to seeing what happens. It's gonna be good.
Lots
I'm
of-
just gathering raw footage and.
And then you're doing lots and lots of editing.
Well, no, we actually have someone who they do movie stuff like professionally, and they are going to help do an actual.
Oh.
I guess.
Yeah, yeah.
Yeah. Have you met them?
Not yet.
I haven't either. But
They just.
Did we sit with them once at
oh
the
yeah,
Mexican
yeah, mhm.
at the Mexican
Yeah.
fundraiser?
Yep.
They were
It's-
very nice men.
Yes.
Yeah.
Yes, and it's some of their people, and I guess these people in particular specialize in making like a $50,000 film look like a $6 million film. So we have high hopes for a $0 film.
So they asked me just to get some raw footage like this.
Yeah.
And they'll do whatever they can do with it, I guess.
Yeah, should be fun. Well, thank you so much for coming all the way out here, and sorry about the address.
Well, I pulled up to that address and I thought like, okay, this looks interesting.
I know, I know.
They kept the house with the 4 sales. I don't think this is the
Yeah,
place.
yeah, no. I didn't even think to tell them the different address. But yeah, so
Okay, cool.
thank you for coming.
Well, not a problem.
Yeah, nice to meet you.
Thank you for all your work you're doing.
Oh, gosh, it's a pleasure. This is a good way to start a day.
Playing with the kittens and eating out sutures. So let's see. Okay, so
I have sutures, yeah.
here, give them to me. I'll put them in. I'll put them on top of the table.
You'll get reports that they ate them. They will dissolve though.
Oh, that's good. It's smaller than the tape. I think actually I may have seen like a blob come out that maybe was tape at a couple of days ago.
Oh, really?
I don't know. It may have been something.
Did they get some drawn to
It may have just been-
defender or something?
I've been deworming them, but then I gave them some revolution, so I didn't do the last one. I might be due for another strong no, not like a worm, but like a tape, like the tape, like not tapeworm, the tape.
Oh, cool.
I was like, oh yeah,
Collar
I
tape.
understand now. Let's see, Dr. Ferguson, do you have any advice on how to choose a good vet? You mean if you can't go to Mountain View?
There are lots of good vets. One of the tricks that you can do is you can call a nearby community at another couple of vets and say that you're moving to an area. What vets would you recommend? People will sometimes say if they're in a different part of the Lower Mainland, what vets will I recommend if they're like downtown Vancouver, or if they're in the North Shore, or they're out in Squamish. And if you ask a couple of other clinics in a surrounding area and they're used to having a relationship and you keep hearing the same names, that's a good one. I have had a couple of, you can go to also, if you're in BC, there's the College of Veterinarians of British Columbia that you can go and look up veterinarians, and you can also make sure that there hasn't been any complaints regarding the veterinarians that you want to. So you can go, and I have even heard that they will sometimes steer you towards certain vets in different communities also. I don't know how official that is. That's one way. Word of mouth, I think friends is good, you know, is another way to help find a vet that matches your goals and gives you the options that you want.
Good answer. Good answer. Someone says you should do YouTube videos with cat advice. So someone asked, let's see where we go.
The chat is moving fast.
Okay, Canary asked, I'm just trying to find it, why does my adult rescue cat just bite for no reason? Is it like a hard bite or just like a play bite? I don't know, we'll see if she can.
And if it's male and black and white, we get it. I think those guys can be precocious, but awesomely so.
Precocious. Let's see, questions. Someone had asked about what are the symptoms. Oh, here we go. For Dr. F, what typical herpes symptoms in cats? Clear, runny eyes. Does it affect ears at all?
Not typically ears. Herpes virus is the most common thing we see, or the little colds that kittens get from shelters are runny eyes, sometimes nasal discharge, sneezing can be, and it can be a combination of a little or both of those things. It can even come up as oral lesions and ulcers in the mouth, sometimes chronic dental disease, and sometimes it can show up as skin lesions. And that's why we put it on the table as possible factors contributing to what TK and Chef have.
That's interesting because I never knew that. Can you overdose a cat on lysine?
I guess you probably could. It's very safe in general. The typical dose for an adult cat to knock down a herpes virus infection that's going on is 250 milligrams twice a day for a minimum of 28 days. So that's usually what a vet would start at, and in kittens it's 125 milligrams. And then it's not really, I don't think there's studies less than 6 weeks. Usually they're over 6 weeks by the time they get to a shelter and someone takes them to the vet anyways. And they're nursing, right? Mm-hmm. So they should be getting some protection from their mom. There probably is an overdose. In general, it's very safe. I've put cats with all sorts of problems on lysine and never had an adverse reaction to the lysine. Sometimes it doesn't work. And there's also a thought maybe over a really long period of time it doesn't work. And there's some cats where it doesn't work and you need to use antiviral drugs, or there's some called famciclovir. There's another one called interferon for really chronic severe infections.
Is it okay or harmful to feed raw chicken neck?
A couple of things. The raw opens up this whole debate. In general, cats are carnivores, and I love them eating meat. The only thing, a couple things, is you have to be aware if you're going to feed raw food that you are going to periodically expose your cat to salmonella. It's going to eventually probably expose them. There have been studies about how often they actually culture them out of how many batches. And then the other is you do have to be aware of the bones. Some of the bones don't always pass super nicely, and I've taken lots of x-rays of cats and dogs of watching bones move through because animals are sick. It doesn't happen a lot, but it can happen, and you have to, at least if you're going to choose that, is go in with your eyes open. And also be aware if you're going to feed raw food that there isn't anybody who's immunocompromised or kids around, because you're feeding raw meat.
Oh yeah, and you told me that the bacteria can stay active, so if they licked a kid with after for
if
hours.
They come in and they're licking in their mouth, absolutely, and they've even cultured the salmonella once it goes in and they ingest it, even if it doesn't make the cat sick, they can culture it in their feces later.
Wow.
And so you have to be super careful, and then also cleaning the surfaces from where you're serving the food on. Not that I'm totally against it, but I think you just have to go in with your eyes open.
Oh, I read something about cooked meat. People were feeding cats cooked meat, and they ended up with like birth defects and all sorts of weird things after a couple of generations. Is that anything you've heard about?
I think, is that just from malnutrition and not being balanced?
I don't know. Actually, I don't know what the cause was. They were the slant of the article was that it was the cooked versus raw meat. It was like cooked chicken breast.
I don't think it's the cooking. I think it's not being balanced.
Okay, that makes sense.
Usually, sometimes we'll do really, for animals, dogs or cats have really severe allergies, and we suspect that, or we want to rule out a food allergy, we'll do a really strict, occasionally, diet trial with a protein source, and usually you can get away with about 6 weeks without having nutritional deficiencies. After 6 weeks, you want to be cautious, and you really want to make sure that the diet is balanced. Because when cats hunt, they would eat all parts of the mouse, and including intestines and things like that. So they're going to be getting some carbs and vitamins and micronutrients and things, that sort of thing. Whereas you're not going to get it if you just eat chicken breast every single day.
Let's see. Oh, someone says, thank you. I see so much debate on the subject, but I trust you. That's good. I trust Dr. Ferguson too. Here's a question. How much does suckling nursing last? How long does nursing last, basically?
For the immunity?
For, I think just how long do kittens nurse?
At Shelley's house, a really long time.
That's
which
true.
is fair. But they didn't put her on the cover of People or anything.
Not yet.
It hasn't gone on for years. You know, I think minimally the goal should be at least about 6 weeks, you know, and then and usually start weaning and introducing food at about 4 weeks, and then 6 weeks, and then sort of tapering off towards 8 weeks. So actually you do things ideally as a breeder would probably do it, and that's not typical for every shelter, so that's wonderful. And because also you want the kittens to get a balanced meal, which they're going to get from nursing, and they're also just as important as they're going to get immunity from their mom.
Mm-hmm. And do they get that the whole time they're nursing, to some extent?
Yes.
Okay, well that's good.
Yeah, it wanes, you know, as time goes along.
Mm-hmm.
But then, you know, they start to build up their own immune system better. They get vaccinated in about 8 weeks, and they get stronger.
Let's see. So
the first 24 hours, is that what you're talking about, the colostrum?
Yeah.
That's what you really want, just like when you hear about with people, is you really want those guys to nurse in the first 24 hours. That's when they're really getting a huge amount of immunity, but they get some protection the whole time.
even if the milk comes in early,
Don't express it, because you just don't want it to.
and it will stay, the colostrum will stay until it's nursed out, so it will stay a couple days until babies are born.
Oh yeah, because
Okay.
I can't see how it wouldn't, because that's what Mother Nature does.
Yeah.
I mean, with cows and dogs and everything. So.
Oh, someone's learning about bite inhibition. Oh, Mr. Caius. 2 on 1. Oh.
WrestleMania.
It is. So Canary said it's a girl cat and she bites hard enough to break the skin, seemingly randomly. Do you have any advice on that?
I would. I mean, that can be hard. You probably want to talk to your vet more specifically. I would make sure you're doing, as you probably are, because Canary, I've heard your post for over a year now and you're wonderful, is make sure your kitty gets tired by doing lots of other playing. You know, otherwise. Also, sometimes you can get a lot of puzzle toys and things where they can hunt so their food falls out. And that will get them a little bit more mentally stimulated. And you can also try to think about it, whether there's anything as far as aggression, or is it territorial aggression, and is there some stress involved? Do you need to play that into effect, or is it just a matter that you need to tire them out? Make sure you also don't wrestle with them, because you're going to be sending them mixed messages.
Like when they're rolled over and you do this with your hand and they gnaw.
And then they gnaw, and
Yeah.
because I see people do that in the exam rooms, and I'm like, I don't know if you want them doing that when they're 10 pounds. So
Yeah, it's not as cute when they're old.
or they're doing it on your friend.
Yeah. Let's see. Anything? How are you on time? It's 10:15. Good. Good to go.
I'm probably next
Okay.
5 minutes I should go.
Okay. One last question. Let's see. I'm gonna scroll through and see.
guys are having a good time.
They're very frisky. I can answer your Roman question. Do you have any other questions for Dr. Ferguson? Okay, I have 2 senior cats who have lost weight, but the senior panel came back negative. So could it be mucell loss? M-U-C-C-E-L-L? I don't know. Muscle
maybe? Muscle loss? I guess it would depend on, there's always more tests that you can do. Just like human medicine, is if the panel came back negative, I would absolutely make sure that you know the status of the teeth and that there's no dental disease in there. Is sometimes kidney values will come back normal on the blood work because they actually have to have 75% of their kidney function lost for it to show up on the blood work. So make sure with that blood panel there actually was a urinalysis also, because you could be missing a whole bunch of kidney disease that you're not picking up by just the blood panel. A lot of vets do if possible, if the kitty has a pee sample, they'll do the pee sample at the time of the at the blood collection. So if a urinalysis wasn't done, that would be something to also do. There's some other fancier tests for thyroid problems, which is a common problem with older kitties that they can look into also. And then make sure if there's vomiting and diarrhea, there's paths that veterinarians, or if they're indoor, outdoor, will they choose to empirically, which we say just deworm just to be thorough. If they go outside or they haven't been dewormed in a long time, there's things like ultrasound, because intestinal inflammation and some types of problems in there, the blood work will come back normal. So I just sort of go back to your veterinarian and have a little bit more of a dialogue and kind of going, what's our next plan if the blood work's normal? There's usually plan B and C.
Good answer. And I don't know, I don't think you said before, but maybe you did, and I was just over there trying to catch a cat. But feline herpes is there. That's a standard vaccine, not a standard vaccine?
It's what's called a core vaccine, about the American Association of Feline Practitioners, and that's sort of this panel of very smart cat vets that sort of go and they debate and they come up with what they discuss as like protocols and and core vaccines, and it comes in feline herpes virus or feline viral rhinotracheitis, you'll see it also called, is a core vaccine. And usually when they're kittens, they have exposure to it twice. There's different protocols if they've been in shelters sometimes of doing extra or starting early, and it depends if they've been with their mom. But it's a good idea to vaccinate. And then if once they're adults and past sort of the 2.5 year mark, you can talk to your veterinarian whether you should be doing it every year or up to every 3 years.
Thank you. That was good. Okay. All right, everybody.
Thank you very much.
Thank you, Dr. Ferguson, for coming. As always, amazingly helpful and wonderful.
You're welcome.
Anyway.
I'm so excited with how their skin looks.
Actually, I'm excited. I know. I'm very excited about your report.
My gut feeling is that they're not going to be very problematic for people.
That's excellent news.
Yeah.
Excellent news.
I think it might just be some tweaking, or we'll see. I don't think it's going to be a big deal.
Awesome. That is wonderful. So, and thank you guys all for watching.
Yeah, thank you.
We'll be heading off soon with 4 guys. Yes.
So excited.
They have their suitcases packed.